Gabby was born with a genetic condition called microvillus inclusion disease. It took a while for the doctors to actually diagnose her because it's such a rare condition. This actually meant that she couldn't absorb nutrients or vitamins or fluids like you or I could, which meant that she needed to be intravenously fed from about 2 weeks old. We was always told in the early days that Gabby would at some point need to have a bowel transplant, and we just had to see how old we could get her really. But around 2 years of age, she started to show signs that her kidneys were being affected as well, which meant that it was a good time to get her on the transplant list for a bowel transplant. Gabby had a very rocky road to recovery, and we spent majority of the last 7 months of her life in Birmingham Children's Hospital. It was a very stressful time, filled with hope, dreams of a normal life for Gabby, because prior to transplant she was hooked up to a drip 18 hours every day. So we just wanted to try and give her a chance at a normal life. For one thing or another, things didn't turn out that way. And Gabby went on to develop something called graft versus host disease, which took over her little body, and she passed away in the October 2012. It was after Gabby passed away that you have time to reflect and think about what might have made things a little bit easier, a bit better for everybody. And it was the complementary therapies that I sort of raised with Gabby's consultant and one of the nurses on the ward who also had a passion to introduce the therapies onto the ward. And that's when Sam contacted Fresh Winds, Sam being a nurse on Ward 8, and started to get the ball rolling, so to speak. When you have a child with a chronic illness, you know that they're not necessarily ever going to get better, and you spend so many hours, days, weeks sat in a room with your child. A lot of the time they're in isolation, so their interaction with the outside world is limited, and so is yours, because you're there for them, to look after them. A lot of the time it's procedures that the nurses need to come in, it's doctors coming in to check the child over, and all of this can be really distressing for the child and for you as a parent, because you're trying to make them feel comfortable. Because it's so stressful, having the option of some sort of complementary therapy, I think would overall give everybody that chance to have some relaxation, to manage some of the symptoms that the children have, and also the positive touch for the children as well, because touch is so important. Because of the times that you just literally sat in a room, I think if there was a service there, a therapist there, to just take you away from that, just for an hour, it would just make your overall well-being, feel so much more uplifted. And sometimes it's just having somebody to talk to as well. I know that within the service we've talked about having bedside treatments, because not all parents want to leave their children. So that's really important as well. And I think that would then have a knock-on effect. If your child sees you having a treatment, then they would feel comfortable having the treatment too. So it kind of just brings you all together.